members of your community that you know may be eligible and have not collected those stimulus payments, please feel free to access the link that I'll post in the chat.
That's great. Thank you so much. What we're hearing from community food share and from the family resource centers is that it's business as usual right now. They are getting, that being said, I know that the Our Center has their direct financial assistance appointments are scheduled way out, but still keep calling because they are referring to other sources. I've heard in City of Longmont that there is utility assistance available through the City of Longmont. So just be on the lookout. Some of the CARES Act funding that's been flowing into the system is going to start appearing in buckets and pockets. And so just be on the alert. I will, as I hear about grants, as I hear about supports that are out there, I'll make sure to blast them out to the community. And as I always say, these calls are intended to be like a pebble in the lake. Our intention of telling you all is that you all then spread the word to your networks. So keep us informed about ways to help spread the word to your networks. I really would also appreciate each of you taking a minute to go to the links that I put into the invite. It's the COVID-19 resources, and there's an English and a Spanish landing page. And I specifically put out the medical resources for today, so you can kind of, if you want to, you can follow along. But remember that website is still being maintained, and we've had, gosh, it was 60,000 hits, and people are finding it very useful, and they're staying on the page and navigating themselves to resources. So please, please, please continue to help us get the word out. We're probably up to 80 or 100,000 hits at this point. It's very, very useful. And just FYI, these programs are serving 30% of the county. Really are reaching people. So please, thank you for your support and thank you for helping us. And I think that's a long enough introduction.
Thanks, Daphne. And thank you everyone who's on the call today. I'm Patrick Kelly, and I run the Special Projects business unit here within Case Management and Community Outreach. And just really appreciate your time today. I think when we came into the pandemic many months ago, it's hard to see the silver lining to what a pandemic can bring. But I think one of the pieces that I've reflected on is that this really shows the intersection of how all of the social determinants of health really relate to our overall community health. And today we want to focus in a little bit on sort of the physical and behavioral health side. I think we've seen through the presentations on this call already how critical housing and food assistance needs are. I think we've had Aaron from Workforce and sharing about how employment is so critical in helping people maintain their housing and be able to afford food. And health coverage also comes into play when we think about it in those terms. We're going to focus our time today on really kind of diving into the equation of physical and behavioral health, but focusing on the helping people to maintain access. We realize that the maintaining access to services doesn't touch on the whole side of how we as a community provide those services, but our work today and our work moving forward in the next couple of months is how do we ensure that folks maintain their access to health coverage, which then provides that window of opportunity into having their health needs be met. I think it's important for folks just to realize that through our combined efforts, we've been able to maintain a historically low uninsured rate in Boulder County. We've been kind of in that 4.5% to 5.5% uninsured rate, which is significantly less than where we had been just 9 years ago in 2011 at 15%. And that's work that we've all done together. And, we realize that with numbers that low, it's often very difficult for us to reach those folks who are eligible but haven't yet enrolled. And I think what you're going to see in the presentation is just some data that we've been able to poll around where some of these folks may be. I think it's also important just to kind of help illustrate sort of the intersection of how the social determinants are at play is Kim Bimstepper, I'm saying her name wrong, the director of HICPUF has shared some survey results they did with folks who have filed for unemployment. And of those folks who are filing for unemployment, 20% indicated, and these are statewide figures, but 20% indicated that they were uninsured. And of that 20%, slightly over 46% of the folks actually said that they had no plans to maintain of coverage. And this is very concerning when we're in a pandemic, especially. We want folks to have health coverage so they can access preventative health and make sure their needs are met, and so that they don't escalate into a higher acuity of need based on unmet medical needs that may impact their financial health. So I think we really need your help today as we try and reach those folks who are eligible but not enrolled. And I think the other critical piece I'll just highlight for everyone is we also know that there's a large number of folks in our county who are accessing and maintaining health coverage, but they're maybe not accessing all of the potential financial assistance that might be available to them to make that health coverage more affordable. And so as again, we go through our presentations today, hopefully understanding where some of those potential areas of assistance might be and helping to direct people to those services is going to be critical. We know that the health coverage ecosystem is super complex, and we kind of pulled together a team of folks who are going to talk about Medicare, Medicaid, and various programs, as well as the Connect for Health programs. And you see our speakers' names up on the screen, and each of them are going to introduce themselves as we go through this. But we want to make sure that you all can kind of understand from the Housing and Human Services, Community Services sort of Boulder County perspective, how people can maintain their health coverage and access the services with us. And that'll help us to serve them most efficiently once they do reach us. And before I hand it off to Maggie Benton from our Area Agency on Aging, I just want to reiterate that you all have helped us significantly achieve these rates of uninsurance, and our goal is to make sure we try and keep people insured so that we can help support them through all the social determinants of health. And if we can meet that medical, physical, and behavioral health side of things through health coverage, that's going to allow them greater flexibility in the other areas of social determinants that they need to address. So with that, I'm going to hand it over to Maggie. And again, thank you all in advance for your help and for being here.
Hi, this is Maggie Benton. Hello, everyone. Welcome to this session. We're excited to be here. I think this might be our first time to participate. We want to let you know that Area Agency on Aging is part of the Community Services Division. So we're outside of HHS. I want to talk about Medicare because in a perfect world, we all turn 65 at some time, right? So if it happens, and Medicare is the healthcare system for people 65 years of age and older, unless they have a special exemption, which we teach about. Our program works also with people who have been on Social Security disability insurance for at least 24 months. They would automatically then roll into Medicare. This is where we start overlapping each other in Medicare, Medicaid. And if you have certain very serious diseases, end-stage renal disease or Lou Gehrig's known it's called ALS, but it's commonly known as Lou Gehrig's disease. those people automatically can get Medicare when they're disability certified. Thousands of people every day are turning 65, and those are the ones that first generally come to see us. And we want you to know that a failure to know and follow the rules around Medicare can dramatically impact the healthcare costs and access to service as we age up. So if you're nearing retirement, if your folks are nearing retirement age, if they're going to quit working and they're close to 65 or above, if they are going from Medicaid to Medicare, if they've already stopped working and they're about 64 and a half, we can work with them. If we want to talk with anyone who has questions about, hey, my mom is got this problem with her Medicare, or is this the right Medicare health plan for my uncle? You know, we will work with family members to help them understand. We do ask that they have either permission with the person on the line or their power of attorney. And we'll also talk with people who are experiencing problems with their Medicare, like maybe they got the wrong plan, or maybe they can't afford it. And one of the things we do is we help screen for ways to pay for Medicare. I don't know, and when I do the regular classes, I kind of talk about our phone number, because the easiest way to access Medicare counseling is through 303-441-1546. We can do the next slide, please. Thank you. So we are also, Medicare is also working into open enrollment period, like just like the marketplace is going into. The open enrollment period is a federal period running from October 15th through December 7th. This is known as the annual enrollment period, or the AEP. And what you can do is, if you're already on a Medicare Advantage plan or a Part D drug plan, a prescription drug plan, this is the time of year you can make changes. You can join, if you're on Medicare in some way, shape, or form, you can actually join, switch, or drop the plan, which plan that you're in. So when you make a change during this time frame, your healthcare coverage then starts January 1st. So this is the make change time. This is a little screenshot of BoulderCountyMedicareHelp.org. There's a way here to go to the schedule an open enrollment appointment with one of our counselors. That's all confidential and at no cost. And we are not salespeople. That may be something that you all don't know about us, because we don't cost anything to the consumer. We're going to try to get their money. We're not about, selling them. We are not salespeople. We're very cautious about that. So we're in open enrollment, but Medicare Basics classes are coming along every single month. We have a schedule that will go up through it'll go through the end of December, and then we'll continue to post it. But we offer those classes, and there's information on getting into a class also on BoulderCountyMedicareHelp.org. So for what we need from you is help us help the citizens of Boulder County, the participants that might need assistance with Medicare. That's what we do. We help. We offer classes and unbiased assistance. And when I say unbiased, it means I'm not going to try to sell you a certain plan or guide you toward one. We're going to help you make your own decision. Again, we are part of Boulder County Area Agency on Aging. Our website is BoulderCountyMedicareHelp.org, and you can reach us at 303-441-1546. And that line will also go to Spanish. And it is my great honor to send off next to Mariah Hinkle from Community Supports. Thanks for letting me be here.
Gosh, Maggie, thank you for that introduction. So, as Maggie said, Mariah Hinkle, I'm a program manager here at Boulder County Housing and Human Services in the Community Support Division. I know I've come and spoke with you guys a few times about the different benefits that we offer. And I'm excited to talk about Medicaid today, as you see that highlighted in my first slide. Maggie just got done telling us about all of the awesome federal benefits for Medicare, and now I'm going to talk to you about Medicaid. So Medicaid is really administered by the state. So we use federal and state dollars so we can cover people primarily low income for health insurance. Our primary determining factor, if you can get on Medicaid, is income. So we're really worried about what income you have and kind of relation to your household. Citizenship does impact enrollment on Medicaid. However, it doesn't completely define it. And what I'm also excited to talk to you about, if excited is the word, is how the current public health emergency is impacting Medicaid coverage. Right here's a quick slide, and Daphne, we could or the link just to kind of show you family or household size in relation to your circumstances of kind of what the income limit or what line of the federal poverty limit that you need to be at to qualify for Medicaid. So families have a little bit higher limits compared to single adults, where it'll be a little bit lower income for Medicaid. I always get questions of like, what's the limit for Medicaid? And it's kind of always hard to pin down without knowing the exact circumstances. So just to update everybody on the current status of Medicaid, right now, our office is just getting inundated with paperwork. To give you guys some context of, we are coming off of some food assistance waivers. So over the summer, we kind of just got to enroll people like crazy on food assistance. We didn't need to conduct an interview. Our verifications were lighter, so we were just signing people up. At the end of August and in September, a lot of those waivers went away, causing us to take longer to work applications and things like that. So once where we didn't need an interview, we need it now. I know we're talking about Medicaid today, but that just, our work times to approve applications are just being pushed a little bit further out right now due to kind of all the extra steps that we have to take with applications coming in. So we also have an increased volume coming with kids going back to school and open enrollment. So not only are our actions taking longer, we have a higher amount coming in, and we also have the public health emergency. I think my next slide explains the public health emergency. Nope.
Spread the word.
Okay, we'll spread the word and then we'll talk about the public health emergency. So spreading the word, we have 45 days to work a Medicaid application. I think this is coming up in another slide, but how you can help us is if someone's coming to you saying, I turned in an application and I haven't heard anything, if we're still within those 45 days, I'm asking to not get extra questions to our office. Just calling us and making us take extra steps to look at it is only delaying the process. The more people that we can have processing, the faster I can get things done. With that, another way that you can help us is applying through PEAK. So if you hear of a client that needs Medicaid and they have pretty traditional life situations, have them apply for Medicaid online through PEAK. Most people receive an automatic determination right there to know if they are or are not eligible for Medicaid. We recommend that you do not use PEAK or you use a paper application if you kind of have some more involved life circumstances. So if you have a sponsor, if you're naturalized or have an LPR card or not a US citizen, I recommend you apply through paper. That process is a lot smoother of getting people entered into our system. If you are self-employed or if you have non-traditional household situations, for example, like I want to file for Medicaid, but I only have my kids part of the time. Another way that you can help us spread the word is to get people to the right avenues. So on my left, you'll see that if someone needs to enroll on Medicaid or has a question if they're covered or not, please send them to us at the county. We can check their coverage, we can start a Medicaid app, we can do all of that. If someone is already enrolled on Medicaid and they have a question about a bill that they received, or if a procedure is covered, or how like their actual Medicaid works, I would call the state. So the state actually handles the billing and they'll be able to help there. If you have questions on how to find a provider or provider recommendations of who takes Medicaid up in my area for this circumstance, I'm going to ask that you direct people to the Colorado Community Health Alliance, or CCHA, which is more commonly called, and they can help direct you to that part. And if I'm not mistaken, I think we're asking to maybe have a special one of these sessions dedicated to CCHA and how we get people connected in our community. So now we get to talk about the public health emergency, and I'll handle this all on my own. Patrick Kelly, please jump in to add some more information. So when the current COVID crisis hit in March of last year, Medicaid said, okay, we know it's important to have people covered on health insurance. So what we're going to do is lock everyone in. Everyone who's on Medicaid is going to stay on Medicaid. You're not going to lose health coverage because you didn't turn paperwork in or because your unemployment put you over income. We want to make sure that you have health insurance. So that was great. We had people covered, and we can't do it forever. So what we're dealing with right now is a situation where we have over 9,000 eligible people, what we considered locked down on Medicaid in Boulder County. And as a group, we're going to work together to try to figure out how we keep the people on who should be on, and then how we transition people off of Medicaid, potentially to shop at the marketplace, who are truly not eligible for Medicaid. As of all the information that we have right now, that Medicaid is guaranteed through January of 2021, unless it's extended again. So that's another volume hit that we're going to take, but you might hear a few like odd questions from people that are coming to you of, I know I make too much money, why am I on Medicaid? It's probably due to this circumstance. Patrick, you want to jump in?
I just want to share with folks that public health emergency is really driven by the federal government and where we are in the pandemic. And so if come January, numbers are still not looking good, then each time they renew for an additional 90 days. And that number is fluid. So as people come into Medicaid, maybe they were eligible for Medicaid back in April because they lost their employee covered health insurance. Now they're working, they make too much money, but they don't get insurance through their employer. They're going to stay all the way through until that public health emergency ends. And so that number of folks that's currently at 9,300 for Boulder County will continue to grow. And we're continuing to work those cases. But that number does continue to grow until we do get to the end of this public health emergency.
I will put, you can always unenroll from Medicaid. Like if someone's like, I don't want Medicaid anymore, I'm moving to California or a different spot, we can take people off based on their request, but it has to be their request to no longer be on Medicaid. And wasn't said, I don't know who I'm introducing, Dale or Patrick?
Oh, sorry.
It's me,
Patrick.
Dale.
Oh, then Dale.
All right. Thanks so much, Mariah. Hi, everybody. My name is Dale White. I also work with Boulder County Housing and Human Services and the Health Coverage Enrollment Center. So I'm here to share with you what services we provide. And I'm going to start out by saying we're certified as an enrollment center by Connect for Health Colorado, Colorado's marketplace. So this is the part of the Affordable Care Act that spans insurance affordability programs. And Connect for Health Colorado is where people can apply for and receive financial assistance to purchase private health insurance. So Medicaid and Medicare are on the public side. Connect for Health Colorado is on the private side. It's quasi-governmental, but it connects people to plans through private carriers. But people can apply for and receive financial assistance, commonly referred to as APTC, which is Advanced Premium Tax Credits or Cost Sharing Reductions. But in short, it's a way to really lower their costs for health coverage. And we'll go into that just a little bit more as we go along. But we've been around since 2013, and this slide depicts what we do. So it's really all the way from understanding health insurance, which, as most of us know, can be really very complicated, and especially for people that are pretty new to insurance. There's a lot of terminology. There's a lot to try to understand, to shop for and purchase one's own plan. We move people all the way through the enrollment process, help them know how to use it, help them stay enrolled through reporting changes, and then also what to expect come tax time, because the premium tax credits are all tied up also with tax filing. Next slide, please. So that's our contact information. It'll be again at the end of the slide. We have appointments available by phone or video conferencing. So we've gone virtual, like lots and lots and lots of places, and we're going to be operating, we think, Monday through Friday, between the hours of 8:30 and 6 p.m. So we're looking to have some extended hours. The virtual world is allowing us some more flexibility with that than we had previously in our buildings, so that we can accommodate people that might need some time after like normal work hours. And so we schedule appointments, but people can also just call in and kind of have a drop in if we have an available health coverage guide. We're also going to be offering those same kind of services with some shortened hours on 3 Saturdays, December 5th, 12th, and then also January 9th. And for those that need some special assistance and phone or virtual just really isn't going to work for them, we will be able to accommodate limited in-person appointments, and that's more likely than not going to be at our Boulder site, 3460 Broadway, but that'll be at the end on the last slide. So open enrollment for shopping in the marketplace is different than Medicare open enrollment. This open enrollment period is November 1st, coming up in 2 weeks, to January 15th, and that's every year in Colorado all the time. And that can be different than the federal marketplace. Colorado has its own. These are our standard open enrollment dates, and that's the period during which people can buy new or change their existing plans. Outside of that time frame, they have to have what are called like qualifying events, kind of big things happen in their life that would allow them to change their plans or shop for new plans, add a family member, whatever it might be. But otherwise, it's just during this time frame during open enrollment. If people enroll by December 15th, if people enroll by December 15th, then their coverage will start January 1st. If they enroll after December 16th to the 30th or into January, it'll start in February. That's that. Now you can go forward, Daphne. Thank you. Okay, so here's some of the data that Patrick spoke to at the beginning, but just to show you the numbers, and part of it is that I want to really kind of speak to the uninsured people in Boulder County in hopes that sending this message out through all of you will help us get to those people. And I want to just preface this by saying all of these numbers are pre-pandemic. And so the folks that have gotten enrolled in Medicaid, yay, great, that's awesome. But there might also be people that are not eligible for Medicaid that could be eligible for the financial assistance through the marketplace, depending on the different eligibility requirements. So we just want to do the best we can to try to keep and or get everybody insured, especially during the pandemic. So of the almost 20,000 people thereabouts that are uninsured in Boulder County, I want to highlight that a pretty high percentage of that group are young. They're 19 to 34. And we also see that there's a high percentage, 35% are eligible but not enrolled in the tax credits that are available to them. And I'm going to show you some, I think, hopefully kind of interesting charts that you can see where they live. We've got almost 25% are Hispanic, Latino, and in Longmont, Lafayette, and Louisville. So that's one of the places we want to try to help spread the word as best we can. And there are those that are not citizens, but may still be eligible for tax credits because they're lawfully permanent residents. And that can be under the not with any 5-year bar. So there's some details and some nuances here. That's our area of expertise, but we want to at least provide some of this foundational information. Next slide. All right, so here's what we know. I want these zip codes so that you can look at your organization and the populations that you serve. Who are you working with? All of those red zip codes, we have somewhere between 40 to 100% of those populations are eligible for APTC. They're eligible for advanced premium tax credits, and they're not insured. All right, so 40 to 100% of the uninsured in that area, not the total population. And the majority of those are 18 to 44. So again, skewing young. In the yellow box, a different piece to really highlight is that 40 to 100% of the uninsured are actually, 40% of the population are actually enrolled in marketplace insurance. They're paying for private plans and they're eligible for tax credits that they're not getting. So there's, you know, two different messages to send out here. One is be insured, and the other is access all the financial assistance that's available to you. So next slide, we're going to go show you what that looks like a little bit. So this is a simple graphic that's merging Medicaid eligibility with marketplace eligibility on a threshold level. Medicaid is determined monthly, so this is just for comparative purposes, but so you can get an idea of the financial thresholds under which people would be eligible for these programs. So you can see at the bottom of the chart in the green are kind of the Health First Colorado thresholds, and then in the middle, and they blend together, we've got the cost sharing reductions along with Child Health Plan Plus, which goes up to about 260% FPL. So those gray boxes give you the idea of the amount of income that families of those sizes can earn and still be eligible for those programs or cost sharing reductions. And then on the top, in one more, sorry. And in the top in the orange boxes, you'll see that that's the range up to which people can be eligible for the advanced premium tax credits. So it's a much higher range, obviously, than Health First Colorado. And I just wanted to really highlight that there's a lot of people eligible for those tax credits that aren't getting them. Next slide. This shows you what that could look like. So the blue bar is the average statewide financially assisted premium cost. All right. So the people that are getting the tax credits let's look at 2019. Go over to 2019 there to the far right side. In 2019, the people that were receiving tax credits on average across the whole state were paying $118 a month for their premium, compared to the people that did not get any financial assistance paying over $500 a month for their premium. And then you see what that looked like in 2020. So this is, again, really averaging, but there are people that can get a lot of assistance to pay their premiums and end up with coverage for a pretty low monthly expense. And we just really, really want to highlight that information. Next slide. All right, so that's what we had for you. We want to remind everybody that we are here to help. And like the Medicare counselors, we're free and unbiased. It's a free service. We help people navigate, apply, and in the full spectrum of insurance affordability programs. Our focus is on Connect for Health financial assistance, but we really support the complicated families. There are families that are in Medicaid, Child Health Plan Plus, and have advanced premium tax credits, and we can help them navigate across this ecosystem of health coverage. There's our contact information, and now we're going to go and shift to giving you a little bit of information about some toolkit elements that the communications team has put together that can be used by all of you to post on your social media, put on your website, request flyers from us or postcards, and we'll send them to you if you're packing them into food boxes or however you want to use whatever these materials are. It's trying to really arm you to help get the word out about our services and about open enrollment.
Dale, would you like me to click in?
Yeah. Yep.
Okay.
And I don't know if hopefully they'll click the toolkit. The top one is, I think, where we really want to go. And you'll probably have to change the screen that you're sharing, Daphne.
Okay, yeah, let me do that. Hang on. Okay.
If you get a chance, Daphne, could you put those in the chat also?
Sure, you bet. And I think it went to health coverage resources. It looked like a Google Drive. I want to make sure that I'm sharing the right.
It is the Google Drive. Yep,
okay.
That's it. It's the Google Drive. Good. If you don't mind helping here, so this is a site that we've shared the link with you to, and all of the elements here are going to be available to you. So let's click into Spanish, and all of this click into English. All of the English resources that we're just going to do a swift walkthrough here are also available in Spanish. But let's click through to the English so I know what I'm speaking to. And here's 3 different things across the bottom. So why don't we do the first one there, if you don't mind opening the open enrollment information with a lot of information on the page, Daphne, the first graphic.
So it's loaded for me. Can you see it on yours now?
Oh, no. Oh, there we go. There we go.
Okay.
So this is a one-pager that's really intended for you and your staff. However, if you think it's useful for any of your clientele, feel free to share it. But it's really encapsulating a lot of the information that we provided here about Boulder County's Health Coverage Enrollment Center. So it's how to get in touch with us. It's just the details of open enrollment, and access, all the points of access to us. So there's a second page with more of that detail about who we want to reach and how people can get covered and all of the dates that we spoke to. So it's really intended for all of you to encapsulate a lot of the basics for your staff and for whomever it might be relevant. Okay, Daphne, I think we can close out of that and go back to the
Okay, let's see.
Thank you for navigating.
Oh, I'm sorry. I'm really struggling today. Usually I can
You seem like you're doing great.
Down. So do you want me to go to the next link?
Go back to the toolkit, the Google Drive page that we were just on.
Oh, okay. Okay. So Google Drive page. Hang on. And okay, and then go back this way.
Google Drive. Yeah, and don't click
Okay.
anything. You're okay.
Okay.
I just
Okay.
wanted to highlight the informational sheet so that you knew that there was somewhere that you could go to access a lot of the details related to open enrollment, to health coverage in our state, and to the services provided through Boulder County's Enrollment Center. And elsewise here, just know that there are social media elements that you can take and use and distribute on your social media outlets. You can take anything that you want and post it or put it on your website. We've just, created these, which typically in a regular year, we'd produce a lot of this in print and we'd distribute it around the community. We'd bring it to our community partner organizations. We'd put it at libraries. We'd get it out wherever we can. Flyers, postcards. This is social media text. If you want to take any and grab it and associate it with your organization. The collateral that we produced has places that you can co-brand and put your logo in if you want. So we're just trying to make as much available as possible to spread the word. And I think I'll leave it at that and just say, all of our contact information is there in the PowerPoint. You can get a hold of us if you need help with any of this or any of these materials. And we also are ready, willing, and able, I think, to distribute hard copy if there's reason for you to have stacks of hard copy that you think you can get out to people. Some organizations that might make sense with current business process, and others it might not. But that's something else that we can do for you. So it's all available in English and Spanish, and I hope that you'll be able to help us keep Boulder County insured.
And not to put you on the spot, but I'm going to put you on the spot, Dale,
Okay.
just because I was surfing here. This is the Spanish version. I'm not seeing that longer one that we were clicking through that's in English. Do we have it yet, and just need to upload it?
I think we're going to have to punt that to Mackenzie or Sebastian to see where we are on that.
Hi, everybody. I just want to let you know that longer flyer will be uploaded. We're almost finished translating it, and it will be available to you shortly. And plug the idea that if there are resources here that you think would be useful that you're not seeing, please feel free to get in touch with me and let me know. And we can happily continue to add resources to these flyers as we go. That's the beauty of Google Docs. So thanks again for your help spreading the word. And please let us know also, as I indicated in the chat, if you need print resources, if that's a better way to support your community members, we're happy to work with you in coordinating those resources.
Thank you so much. I have a quick question for you guys. With eligibility, so obviously part of this huge thrust is for open enrollment. I've also heard when somebody is a qualifying event that you get sick because of the pandemic, does that become a qualifying event at all? And the reason why I'm asking this is I've heard of people going into the hospital and then getting bills, but then qualifying for Medicaid right then when they're in the hospital. Obviously, that's what we'd rather avoid. We'd rather get people in front of it. But can you speak to that, Dale?
I think so. It's actually two different things. One is Medicaid's relationship to COVID-19 and the different kinds of coverage that is provided. So I might punt that back to Mariah, although I know it, I'd rather she spoke to it. And then the other is private health insurance. To the best of my knowledge, having an illness or having something happen, including COVID-19, would not qualify as a life change event. It's not part of what is defined as life change events.
And Mariah, before you jump in, I think, Daphne, where you may be picking up on this is when the pandemic first hit, there was a special enrollment period that was enacted to allow people who had no insurance to enroll through the marketplace that ran for about 6 or 8 weeks in April, till about the end of April. So that was a specific enrollment period that the state of Colorado enacted to allow people to have a greater period of time who may have been who were uninsured but wanted to be insured as a result of the pandemic.
That's probably exactly right. Okay, thank you.
And Mariah, I'll hand it to you for the Medicaid piece.
Yeah, I don't know if I even need to jump in on that, but you guys covered it. You do not need a qualifying event to get covered on Medicaid. So there doesn't need to be a life change event. You can apply for Medicaid at any time. It's mostly income based.
I think that's what it is, Mariah. Thank you so much. I think what we've seen happen sometimes is someone, suddenly is injured, loses a job during the non-enrollment period. So let's say you've gone through this enrollment period here, you've got your insurance, you're humming along, then you get COVID in March, you lose your job, lose your insurance, which I don't even know if that's legally possible, but let's say that happens. Then you can apply, let's say you then recover. My understanding Medicaid has a look back period of like 30 days. So you recover 2 weeks in, you're like, oh my gosh, I'm not covered. You can apply for Medicaid right then. It'll look back 30 days. Is that right?
Medicaid has a look back period of 90 days. So we can cover, if you're eligible for Medicaid in those months, we can look back 3 months prior to your application and do retro coverage for that month. This might get a little hairy in the technical aspect. You can apply for Medicaid as your secondary insurance if you have other insurance, but what you cannot do is be enrolled on the marketplace receiving tax credits and enroll on Medicaid. So if I, as a Boulder County employee, qualified for Medicaid as my secondary insurance, I could apply for that. I could not go through the marketplace, shop for insurance, be getting the tax credits and be on Medicaid.
That'd be double
Dale, did I say that correctly?
Yeah, I think so. I think you did, Mariah. But I wanted to go back to what Daphne was laying out as a scenario and just highlight that loss of a job or loss of income is a qualifying life change event. So anytime, or loss of coverage. So if somebody has employer sponsored coverage and loses their coverage, that's a qualifying life change event. So depending on their income levels, it would be Medicaid, or they could shop with financial assistance through Connect for Health Colorado when that happens. And one of the things that we really, want to advocate for is for people to be reporting their changes and updating their cases, if you will, whether that's on Medicaid or Connect for Health Colorado, because maintaining seamless coverage is really the idea. We don't want there to be gaps and then hope that maybe it's Medicaid eligible and they have a 90-day look back. It's like, we just want to proactively report those changes and keep people covered.
Great. Thank you so much. We are at the Q&A stage of the presentation, as you might have guessed, and I've been asking the majority of the questions so far, but I know folks can put them in the chat or you can unmute yourself. Let me go straight over to the chat because I just noticed a couple of questions coming up, and let me go to the top here. Okay, so I see Amanda, of those currently on Medicaid, how many do you estimate might lose coverage if the public emergency ends?
Patrick, you can jump
Yeah.
in if you want to. I personally wouldn't feel comfortable giving a number just because of how our interfaces work with the state and our outreach efforts that we're going to try to do. I don't know if I could definitively say I think this many people will lose coverage.
So I think what we can say is, right, we have 60,000 folks or 90,000 on Medicaid in Boulder County currently. We've identified these 9,300 that are part of the locked-in report. What Dale was referring to, and also I think what Mariah has said is, one of the critical pieces is some of those people who are in the locked-in report are eligible for Medicaid, and it's just that we need some additional paperwork or some additional verification from them. So I think it's gotten confusing for clients because we had waivers that said you don't need to turn anything in, we don't need anything. And I think that's where we can we're trying to work those numbers, that 9,300, to identify, as Mariah said, who potentially is eligible for coverage. Once we get them definitely defined as being in coverage, they come off that list. Probably the best number we could probably share is those who are actually over income. But again, the over income piece is based on when they were enrolled, or not when they were enrolled, but when we had an interface that hit that said they had income that they didn't claim on their application. And so even amongst those number, we can't really identify whether or not they would lose Medicaid coverage for being over income, because we need to verify that income. So I agree with Mariah. It's some number less than 9,300 who would be in jeopardy of losing Medicaid coverage, but they may shift to other public benefit coverage. And what we're trying to do is have that seamless transition over to Connect for Health if they're eligible to purchase. And that's why we're spending some time today trying to help you all understand this. So Amanda, you can kind of look at some number less than 9,300 would potentially be in that position to lose coverage.
Great.
It's kind of a non-answer, but it hopefully helps you gauge.
That does help. She says thank you. Great. And from Sheila Davis, what about access to insurance for mental health services? Do you provide information to clients on this?
I'll take that one. I'll take that one on the marketplace on the Connect for Health Colorado side. So our health coverage guides help people through the application process and then also support their choosing a plan. So it's really about what are the plan features, and there's lots of variables associated with all those plans. And there's different tiers. They call them gold, silver, and bronze. And it's like how much you pay in your premium and what your deductible is and what your available, what kind of services are included, mental health, dental, medical, etc. So yes, the answer is yes, but there's a lot to unpack there.
And also help me out if I'm wrong, but as I understand it, there is a SAMHSA for mental health. There's a SAMHSA site you can go to, and you can find providers who take different types of insurance. Do you know what I'm talking about? It's like a,
I don't.
okay, I'll find that and I'll post it. It's really, really helpful because it can give you even like the degrees and qualifications and stuff like that, and definitely if they take Medicaid or not. So I'll post that later to the chat.
Daphne, I'm going to give another plug to
Yeah.
the Colorado Community Health Alliance, or CCHA, for people who
Okay.
are enrolled on Medicaid. That's the best number to contact for mental health services.
That's a great point. So it's cchacares.org. Is that right?
If that's what my slide said.
Because I'm about
It
to.
did.
Okay.
I'll, I'll get there. I'll take
Okay.
a look.
It is. Isn't that the one that wrapped, Mariah, that you told me to?
That was fitting correctly.
Oh, .com. It's .com. Okay.
Oh, I'm
So,
wrong.
and again, for those who don't know, CCHA is what they call the Regional Accountable Entity, and they really are in charge. They're like the air traffic control is the best way to think of it, and they'll help you figure out where your plane can land and if there's capacity at that landing spot. So CCHA is a great spot to go, and actually a little easier to navigate than the SAMHSA site. Okay, so I have another question for you. I want to go to that tax credit piece that's clearly underutilized in the community. When we say tax credit, sometimes I don't really know how a tax credit works. And it says monthly it's tax credit, but what does that really mean? Is it really actually just a chunk of money off your taxes once a year, or is it money flow? Who can take the what's the what about a tax credit and why we should care about it?
Gail, do you want to take that one, or?
I'm going to see whether Sebastian will unmute himself and take it. I can, but I think Sebastian, if you're willing, I think that you might be the more nuanced speaker on this.
I'm sorry, can you repeat the question?
Sorry. Thank you. It's about what a tax credit actually is and how it relates to people filing their taxes. What does it mean for somebody to get an advanced premium tax credit?
So when you apply for this benefit, so you need to estimate your income for the year, right? So let's say somebody's coming to apply for tax credits for 2021. So they're going to need to estimate their income for that year. So based on that number, we use different tools to estimate the benefits that they might qualify for. And there's two ways to take advantage of this benefit. They can take it monthly. Is that?
No, you go ahead. I'll see if I can find whose phone ringing and mute them. Oh, maybe they did. Okay, go ahead.
So you can take that benefit monthly, or you can take part of it, not the whole amount that you are eligible for, or you can wait until you file taxes in order to get that benefit as a refund, as part of your refund. So that's, I don't know if I'm answering the question.
I think it did, and I'll just put a kind of like an underline in it. It's an advanced premium tax credit when you take that credit in advance of the year-end reconciliation and you apply it monthly to reduce your premium. So that estimation, you're forecasting your earnings, and that estimation is what gives you, oh, you're going to get $400 a month as a tax credit. It's really like money that's going to come back to you from paying taxes. Like instead of paying that, you'll get it as a refund. And you can take it in advance monthly and reconcile at the end, or you can wait until the end and reconcile and just take it as a lump sum.
And what we were seeing right there with your estimates, that could be $4,000 in a year. That could be
Absolutely
a lot
Absolutely.
of money.
Yes.
So the outreach, and you said that like one of your slides really talked about how Hispanic workers paying taxes
Yes.
are underutilizing this benefit.
Yes, in Longmont, Louisville, and Lafayette.
So what is it that we on the call can do? Like, that $4,000 is a lot of money, and that's probably the smallest amount because that's the individual, right? Almost.
Well, it depends. It's a sliding scale, right? So it depends
Yeah.
on where you are in that income threshold. So
Sure.
we have to be careful to like set
Not
expectations.
oversell it. Okay,
appropriately.
yeah.
Yeah.
But it's going to be probably a minimum of $500 in a year, probably. There's my dog, you guys. Sorry. But anyway, the question is, what could we do in terms of getting that word out to our networks? How can somebody tell whether or not they could qualify?
Well, maybe there's something for us on the communication side to think about some of the information that was packaged in the slide deck that we can put together in some simple way, and or connect with the information from Connect for Health Colorado, because they have collateral, they have marketing materials.
Great. CCHA is on the call, and I said I was going to call on Brandon next. So Brandon, maybe you can pick this thread up and then also tell us a little more about your role.
And Connect for Health Colorado is not CCHA.
Oh, I'm sorry.
Yeah. Connect for Health Colorado is the marketplace. And so
You're right.
we can, they message this, but it's understanding this health insurance ecosystem. So I think it's really, we need to condense the point being that financial assistance is available and it really could be significant. So if you haven't looked into this, you should contact us and we'll help. That's really the gist.
Okay, thank you. Brandon, welcome. And if you could just introduce yourself, take yourself off mute if you're on mute, and tell us about CCHA and how you can help.
Sure thing. Hi, everyone. My name is Brandon Stepter with Colorado Community Health Alliance. I'm a community liaison there. Just real quick, I think someone mentioned that we could do a whole training on CCHA. But real quick, we're just the reasonable accountable entity that essentially comes in with additional supports once someone is on Medicaid. So we support with finding a provider, getting connected to the provider. We also have care coordination services. So if you have any specialty needs. And I believe the question earlier was also around finding mental health providers. We do that as well through our provider networks, as well as some additional networks that we have. So there's a lot that we do. It could take up the whole training, but that's kind of the lightning round of CCHA. So if you have any questions, I put my information in the chat. Please feel free to email me and I can have further discussions.
Great. Thank you so much, Brandon. Any questions? We've got 1 more minute to the top of the hour. Please identify. Great. Hearing none right this minute, and although if anybody wants to come off mute, I just want to thank everybody, thank our speakers, and really appreciate that everyone called in, and please help us get the word out again to families, friends, neighbors, relatives, that there's a lot of resources out there. Tap into them. And as Patrick said, take pressure off your budget, your other budget, by using some of these resources. Okay, here's the site. Oh, thank you so much, Sebastian. Appreciate it. There's the SAMHSA site. All right, thanks everyone. We'll talk soon. Send us resources that you want us to get out to the community too, and we'll make sure to send those in email blasts, etc. Take care.
Thanks, everybody.